In this video, I'm going to review the clinical symptoms that is associated with disc herniations at the levels of L4 and L5, as well as L5 and S1 vertebral discs. Now, what happens with the disc herniation is that at the level of L4, L5, it's the L5 nerve root that will be affected. Likewise, with the L5, S1, it's the S1 nerve root that will be affected. And so let me show you in this diagram why that's the way that the nerves will be affected. So here on the top we have the L3 vertebra, then we have the L4 and then L5, and then after that we have the S1. So with the L3, L4 vertebral disc herniation, which will happen here, you see that it's the L4 nerve root that will be affected. So with the L3, L4 disc herniation, it's the L4 nerve root that will be affected. With the L4, L5 disc herniation, which will happen right here, it's the L5 nerve root that will be affected. So with the L4, L5 disc herniation, it's the L5 nerve root that will be affected. And then finally, with the L5, S1 disc herniation right here, it's the S1 nerve root that will be affected. So now you can see that with the L4, L5 disc herniation, it's the L5 that will be affected, and L5 is required for the sensation of the foot dorsum as well as dorsiflexion. And so therefore these functions are the ones that will be decreased by the L4, L5 disc herniation. With the L5, S1, S1 nerve root is required for the sensation of the sole of the foot as well as for the plantar flexion of the foot. So these functions will be affected. In addition, S1 nerve root is required for the ankle reflex, and therefore ankle reflex will also be decreased by the S1 nerve root damage. So the way I memorize the function of L5 and S1 is that I always remind myself that the L5 nerve root is above the S1 nerve root. So therefore, since L5 is above, therefore it's required for the sensation on the top of the foot, and then it's also required for moving the foot upward, meaning that it's required for the dorsiflexion of the foot, while the S1 nerve root is at the bottom, so it's required for the sensation at the sole of the foot as well as for the plantar flexion. So let me show you again in this image. So L5 is on the top, so it's required for the sensation on top of the foot as well as for the dorsiflexion, while S1 is the lower nerve root, so it's required for the sensation on the sole of the foot as well as for the plantar flexion. And then with the reflexes, this is an easy memory aid to help you remember S1, S2, L3, L4, C5, C6, and C7, C8. So I would like you to know that S1 nerve root is required for the ankle reflex, L4 nerve root is required for the patellar reflex, C5 is required for the biceps reflex, and finally C7 is required for the triceps reflex. So therefore with the L5 S1 disc herniation, since the S1 is affected, therefore the ankle jerk reflex will also be decreased. And then one final point I would like to add is the C6, C7 disc herniation. So I'm going to ask you this question: what nerve root will be affected by the C6, C7 disc herniation? And the answer is C7 nerve root. Now C7 nerve root is required for the triceps reflex. So therefore with the C6, C7 disc herniation, there would be decreased triceps reflex. And then given that C7 is also required for forearm extension, therefore it will also cause decreased forearm extension. And that concludes our discussion of disc herniation at different vertebral levels.